Welcome back to the American College of Surgeons Bulletin Brief from the front line, Surgeons' Voices. With me today is Dr. Mariana Berho. Dr. Berho is the Chief of Pathology and Laboratory Medicine at Cleveland Clinic, Florida in Weston, where she is also the Chief of Staff and was formerly the Chief Wellness Officer for the Cleveland Clinic, Florida region. Welcome, Dr. Berho.
Thanks so much, Steve. Thank you for having me.
Well, the reason we have you here today is because of a superb lecture that you gave during the recent Quality and Safety Conference in a session entitled Solutions to Support Wellbeing for Surgical Teams. And that session was co-sponsored by Ariadne Labs, and I had the privilege of co-moderating with Dr. Mary Brindle from Ariadne Labs. And you gave a very, very compelling, insightful talk about wellness programs. So in case people didn't see that segment, and they still can, they can still go online and look at the quality and safety sessions. I'd like them to, but perhaps you could just summarize a little bit about your topic.
When I became the Chief Wellness Officer, and this is before the COVID-19 pandemic, the first thing that we did was to create a council of doctors of the different departments and institutes that were particularly interested in the wellness of the physicians. Based on previous surveys that our doctors have taken, we realized that there was a lot to be done related to wellness and well-being. So that was the first thing that we did. We had a council, we chose the different members, and we had a lot of great ideas that we wanted to start working on, and that's when COVID-19 hit. So most of what we talked about in that lecture that you're referring to was the initiatives that we as a council, as a group, took to try to support our physicians during the COVID-19 pandemic.
So perhaps you could start out by telling us the composition of the group, what types of people were in this group who were creating the programs to support the physicians.
So we have representatives of each department. We call them physician champions. And this was voluntary, of course. And we sought the opinion of the department chairs and institute chairs as to who would be somebody interested in being part of that. So we have representation from pretty much all the specialties there. And one of our members is a social worker. She has worked in the healthcare system for a long time, so she's very familiar with the struggle of physicians during normal times, and particularly now with the pandemic.
Great. So a lot of representation from many different areas, lots of stakeholders for lots of good dialogue and ideas. And there's two phases, because you mentioned that the council convened prior to COVID. So what were some of the programs that were being implemented before the pandemic hit?
The word wellness mostly refers to the physical health of an individual. What we wanted to do was more of a holistic version of it, that is the well-being. And within well-being, you have the physical aspect, but you also have the emotional aspect, you have the spiritual aspect, the social aspect, and even financial aspect. So we had created different committees that could look at different initiatives. For example, one of the things we wanted to look at was the possibility of having a gym inside the building where we all practice, so physicians could use it early in the morning or late in the afternoon. That was one of the things we did for wellness. We had several courses for leadership development, coaching, mentoring. And as I'm telling you, this was on January of 2020. So pretty much we started planning, and really a lot of this went into the back burner with the pandemic, and we started concentrating exclusively on how we can support our staff during that time.
So I'm going to digress just a bit before we get into some of the COVID programs, because you mentioned two words, coaching and mentoring. And it's well known that you're certified as a coach and you've worked as a coach for many years and also have your master's degree in conflict resolution. So you'd be a good person to explain to us what is the difference between coaching and mentoring?
The difference between coaching and mentoring is pretty much who is going to discover what that person has, the potential of that person. Mentoring is usually a more direct way of guiding a person. Most of the times in the medical field, a mentor is somebody that is maybe in the same specialty, or a surgeon of another specialty to another surgeon, where there's a much more directed, if you want to use the word advice, that's a good word to use, where there's advice and guide as to where to go in the career of that person. Coaching is different because the coach and the coachee have a different relationship. In coaching, the coach helps the coachee, her or himself, to find what the objectives and goals are and come up with ideas or options to realize those objectives and goals. So the coach does not necessarily propose any kind of specific option. Is the coachee that through talking, listening to her, himself, and some conversations with the coach comes up with her or his own plan.
Thank you. Very helpful to understand that difference. Now, to get back from our digression, perhaps you could explain some of the specific wellness initiatives that were brought on during the pandemic.
We had several very practical initiatives. For example, one of the things that we saw from the very beginning is that going to the grocery store was quite of an ordeal. To get in, you had to wait in line to get in. For many of the working professionals and non-professionals, this was extremely difficult to achieve because people had to come and work. So we had an arrangement with our local grocery store that allowed us, all employees of Cleveland Clinic, to use the grocery store an entire hour before the store opened to the general public and 1 hour after. So very, very practical things that help in day-to-day life. Another thing was the schools were closed. So many we have it, as you know, a young staff, and maybe a lot of our physicians, nurses, administrative staff had to figure out a way to help their children to attend the classes online. And this was quite challenging for many of us. So we created a network of tutors, certified tutors. This is, of course, with the support of the Cleveland Clinic at main campus. And we interacted with the different tutors. Sometimes they were professional teachers, but some other times were, for example, college students that could not attend the regular classes and they were also learning online and would be willing to help the kids with the online classes. We created a system of emotional support, mostly through the Cleveland Clinic in Ohio, where our employees could call 24/7 and have let's say, urgent consultation with a psychiatrist or a psychologist. No insurance was necessary. It was just done when there was an emergency or somebody that really felt they needed the emotional support right there.
Excellent. Could you tell us a little bit about some things that you still would like to do, some programs you might like to implement, perhaps post-COVID, some things from COVID you might want to change, some additional programs you mentioned from earlier that you might want to re-explore once COVID's hopefully one day behind us?
I think that each well-being program needs to assess what are the needs of the physicians. For example, as you know, here in Cleveland Clinic in Florida, and I think it's all around the healthcare system, one of the biggest issues that we have is related to the medical record documentation and the in-basket messages, etc., etc. So many of the initiatives that we have right now are related to efficacy of practice. So we want to make sure that we give our physicians the time that they need to become experts on the epic area that they practice on. So it's going to be different for a colorectal surgeon than for a rheumatologist. So we want to make sure that people have the time. If they need to take an entire afternoon of clinic, we want to make sure that happens. We want to make sure that we have enough support staff, that the in-baskets or the telephone calls can be screened before they get to the physician. There's a lot of cognitive kind of tiredness, if you wish, that comes from this, and that takes you to the burnout, right? I mean, it starts with the cognitive stuff, but then it advances to the emotional and spiritual aspects. So we want to attack that right now.
Great. You mentioned burnout, and I can't possibly end the interview without asking you a little bit about what are some of the signs of burnout that we should be aware of in our colleagues, and then what are the resources in those instances to try to help those individuals?
Yeah, burnout is a syndrome. The word burnout comes from a psychiatrist. He used it for the first time when he was evaluating addicts, and the addicts would be smoking, and they would smoke until the cigarette burned out. And so he used to use that word, and then it became like the common word to talk about somebody that is emotionally exhausted and somebody that has lost purpose. When we're talking about our profession in medicine, that has lost the spark, the purpose of practicing medicine and helping other individuals. And the third component is that we start, when you're burnout, you start to have a cynical way of looking at things and approaching issues. So it's, a real bad combination.
And then what would be resources? I mean, if somebody sees a colleague and they see some of these symptoms being manifest, how should they approach that individual, or should they approach somebody else and let them know about the individual, or both?
We have several surveys that actually validated surveys that are used to probe burnout in physicians. We use a particular one. This is the Stanford survey, where there's several metrics that are taken into consideration. These surveys are very useful because they tell you what is the most urgent thing you need to work on. One of the metrics is flexibility of schedule, for example. If flexibility of schedule is the one that jumps up, for example, more than the issues with the medical record, then we immediately know where we need to concentrate our efforts first. We need to understand that not every issue has a quick solution. I think understanding what's going on, validating what people are going through without dismissing is a very, very important first step. Most of us, just when we are validated by others, when we express what we're going through, already that is progress. So again, I think that we need to come as a group. And for example, for us, flexibility of schedule was the number one thing, and come up with creative ideas as to how we can improve the schedule and the flexibility. And as you know, I mean, we have worked hard on this. I strong believer in flexibility of schedule. And we continue to do that with the different departments because each department is different.
Thank you very much. Certainly a wealth of information, which I'm sure will compel people who weren't fortunate enough to attend our session during the Quality and Safety Conference to do so online in the archived material. So thanks for your time and expertise during that session and again today.
Thank you very much.